Welcome back to American Medicine Today. This time we're going to discuss degenerative disc disease. Dr. Bonati, many people are searching the internet for degenerative disc disease. What is it and how can your techniques help?
The name is telling you, okay, is that the disc, for whatever the circumstances, is being affected and they lose fluid content of the disc. When that happens, the shock absorber type of a behavior of the disc disappears. That can be associated with trauma, can be associated with normal degeneration of aging, or can be associated sometimes with a situation that people is born with some type of abnormalities that they create degeneration on the disc. The disc is a spacer that between two vertebrae, and what they do is they maintain the separation of one bone with the other one,
right,
to protect not only the bone but at the same time to allow the motion, so you can twist and turn a little bit because the disc manipulates in certain way that the spine can move easier, and certain amount of degrees are assigned to every one of these areas. So when the disc degenerates, two things can happen. You can have an initial part of the degeneration where the disc still remains maintaining the separation of the vertebrae almost normal, but the disc becomes that
cushion
material, that fluid material,
right.
And when that happens, then you develop some back pain. The symptoms that they are associated with the disc that is degenerated is back pain. And back pain is universal, one of the most big problems and one of the most discussed type of subjects in spine, why the person has back pain.
And when you say back pain, you mean just localized back pain, or can that pain shoot anywhere else on the body?
It's a combination of things. Usually when we talk about degenerative disc, just only back pain. Doesn't go anywhere unless the disc ruptures and then affects the nerve. Why the back pain becomes a problem? Well, when the disc degenerates, the height of the disc becomes smaller, becomes flattened.
Sure.
And the disc changes color. If you do an MRI, the disc is usually white. But when you have a degenerative disc, the disc that loses the fluid, then that disc becomes black. And that's an indication now that you have a degenerative disc. What happens when you have a degenerative disc? The height between one vertebra and the other one decreases. But when that happens, the pedicle of the vertebra lowers. And when the pedicle of the vertebra lowers, will touch the axilla of the root. The root is part of the nerve that is exiting from the spinal cord. So that part of the axilla is the nerve coming from the spinal cord. When you touch the axilla, the nerve that is in the axillary area, you touch the nerve there, the patient always say back pain. So we identify that one after hundreds and hundreds of cases that we did. We create a map, and that map is very similar to the map that is in the anatomical books. But when we start to look at those ones, they have differences. We create something that is more accurate.
The pain path.
The pain path.
Yes.
Because we touch areas of the nerve, and the patients, hundreds of patients, tell us exactly where the pain is. Sure. Then we start to register where that pain was in each nerve. So we were able then to exactly know when the patient said, I have a back pain, I know exactly which nerve is giving the problem and where the problem is. After we were able to identify why that happens, now we have a solution for that. Even myself and my surgeons in the past, we didn't know where the back pain was coming. Right. And every time the patient comes with back pain, we go, We don't know why it's back pain. So we give them shots and things like that. That thing doesn't work.
Decades ago.
I'm talking about decades ago.
Yes.
And in the years after that, we start to do the pain path. And when we have the pain path, we need to identify each nerve, where it goes, in every segment of the nerve, where is the pain located.
Right.
So when we did that, we have a clear information where the problem is.
Yes.
Then the patient comes over and say, I have a pain that's affecting my back and goes to my butt and then a little bit on the back of my thigh, but that's it. I know where I need to go, exactly where I need to go to correct the problem, because thousands of patients told me the same thing.
Right.
And every time that we operate, we touch the nerve and identify the area. Once we have clear where the problem is, we always can solve it.
Yes.
Because we know where we need to go and how we need to do it. That is why the back pain today for us is not a mystery.
Sure.
Because we know where the problem is, and then we look at the disc, and if you have 1 or 2 or 3 discs that they are degenerated, we know that we need to clean the specific areas of the roots where the axilla is in each nerve, or otherwise the pain is not going to go away.
Right.
That's why back pain is so confusing, and that's why back pain usually today, very few people understand.
And what's so amazing is that your phone evaluations are spot on. Time and time again, we hear from the incoming patient, I couldn't believe it, he diagnosed it over the phone, even without any imaging. And then you do the in-person evaluation, and they said, I can't believe it. I didn't have to tell them any of my issues. They told me what I was feeling. If you've been told that you suffer from degenerative disc disease, you can reach out to Bonati for more information on how they can help you. Thank you for watching American Medicine Today.